6 months without a leader, the World Trade Organization has appointed Nigeria's Ngozi Okonjo-Iweala as its first female and its first African Director General. Dr. Okonjo-Iweala is Nigeria's former finance minister. The new head of the WTO is not a trade expert, but says she can bring in fresh leadership to the global trade body. The 164-member body has been without a leader since Brazil's Roberto Azevedo left a year early in August. Supporters hope she can reinvigorate the institution, which is facing the biggest crisis in its 26-year history. Many of the problems have to do with members unable to agree on trade deals and a reform program. The World Health Organization has listed AstraZeneca and the Oxford University's COVID-19 vaccine for emergency use, widening access to the relatively inexpensive shot in the developing world. The listing by the UN Health Agency comes days after a WHO panel provided interim recommendations on the vaccine, saying 2 doses with an interval of around 8 to 12 weeks should be given to all adults and can be used in countries with the new virus in South Africa of the coronavirus. The WHO's review found that the AstraZeneca vaccine met the must-have criteria for safety, and its efficacy benefits outweighed its risks.
Today, WHO gave emergency use listing to 2 versions of the Oxford AstraZeneca vaccine, giving the green light for these vaccines to be rolled out globally through COVAX. One of the vaccines is produced by SK Bio in the Republic of Korea, and the other is produced by the Serum Institute of India. Although both companies are producing the same vaccine, because they are made in different production plants, they required separate reviews and approvals. WHO emergency use listing assesses and assures the quality, safety, and efficacy of COVID-19 vaccines, and is a prerequisite for vaccines to be distributed by COVAX. This listing was completed in just under 4 weeks from the time WHO received the full doses from the manufacturers. In addition to the Pfizer-BioNTech vaccine, these are now the second and third vaccines to receive emergency use listing. We now have all the pieces in place for the rapid distribution of vaccines. But we still need to scale up production, and we continue to call for vaccine developers to submit their dossiers to WHO for review at the same time as they submit them to regulators in high-income countries.
The Health Ministry in Guinea says at least 4 people have died of Ebola in the first cases of the disease in the country over 4 years. 11,000 people were killed by Ebola across West Africa between 2013 and 2016. So Guinea is now tracking down people who potentially came in contact with Ebola patients and will rush out vaccines to the area as soon as it can get them. The second deadliest known outbreak was declared over last year in the Democratic Republic of Congo, but that country has also recorded new Ebola cases this month, alarming global health officials. Let's chat now to the World Health Organization's representative in Guinea, Dr. Georges Kizerbo. A very good evening to you, Doctor. Thanks indeed for your time. So this is the first time the disease has been reported since the outbreak ended in 2016. Do we have any more details about this new case?
Yes, yesterday the Minister of Health of Guinea declared the re-emerging outbreak of Ebola disease in the district of Geke, in the prefecture of Zerekore, in the forest area of Guinea. 7 cases were notified yesterday and 3 deaths. So what is ongoing is an investigation to try to trace the chains of transmission and try to find out all the contacts and of the first cases, and try also to see the source of this new outbreak. And also the response teams are already working for case management, contact tracing, and also isolation and quarantine of the contacts and suspected cases.
Yeah, I also understand Guinea health authorities were also assisting the Democratic Republic of Congo with the recent outbreak. Has that managed to alleviate the strain, I guess, on both countries, as we're all battling a global pandemic on the other side?
Yes, I think this is a great asset, having all the teams of vaccine experts and vaccinators who worked in DRC to contain the recent outbreaks in the DRC. So this expertise is being mobilized again and utilized to help in the current response.
And I mean, the WHO, have you reached out to other countries, at risk also in the sub-region?
Yes, as you know, after the declaration of the outbreak, the World Health Organization Emergency Program held a 3-levels meeting yesterday to try to assess the situation. So there will be a grading of the event, taking into account the national risks and vulnerabilities, but also the cross-border dimensions of the event. So the countries of the Mano River Union, including Liberia and Sierra Leone, and other neighboring countries such as Cote d'Ivoire, Mali, and other countries, and neighboring Guinea, will be preparing readiness plans and be on alert. So the governments and the technicians and scientists are liaising to have readiness and preparedness at regional level.
And I guess, Doctor, the issue of the borders is of concern. Listening just a couple of hours ago to the Director General of the WHO, Dr. Georges Kizerbo, he indicated that the Democratic Republic of Congo outbreak and that of now in Guinea are unrelated. But of course, I guess the issue of the borders and concerns over those sub-regions would be something that would need to be dealt with as soon as possible.
Yes, exactly. I think the cross-border movement of people, these are the same communities moving back and forth across the borders. So it is important that in addition to the medical measures, community engagement from both sides of each border is taken into account, and that clear messages are sent. And also measures are put in place at entry points to protect the people moving and prevent the geographical extension, as we have seen in the outbreak from 2014 to 2016.
The World Health Organization representative in Guinea, Dr. Georges Kizerbo, thank you very much indeed, talking to us about the outbreak. At least 4 people have died of Ebola, we understand, in Guinea, according to the health ministry there. The first cases of the disease in the country over 4 years. Thanks indeed for your time this evening. A short break here on The Full View. Much more when we get back.
I'm an ex-offender. I served a 10-year sentence. Prison, it required 16, 17 hours. Nakimamela radio every day. And Ukozi FM gave me hope during my hopelessness days. I'm a CEO and founder of Ukozi Solutions. Its primary focus is to deal with corruption, bribery, fraud, and theft. Imagine from prison to businesswoman/entrepreneur because of SABC Radio.
Immerse yourself in the possibilities that could be with Lotto, Lotto Plus 1 and Lotto Plus 2. Tune into the Draw Show every Wednesday on SABC 2.
I can't hear you.